So, good morning. I am Isa Hamza. I'm going to demonstrate the perineal care for female. Perineal care is the cleaning by way of washing the genital and anal area with plain water and medication solution. The purpose of it is to clean the perineal area of bodily secretion and excretion. The second is eradicate the unpleasant odor. Third is to prevent skin irritation. Fourth is to prevent infection. And fifth is to provide comfortable. The materials needed is bed pad with cover, the waterproof underpad, bath blanket, a tray with the following: pitcher, pick up forceps, clean gloves, perennial pad, dry cotton, cotton ball with soft side solution, dry os, weights receptacle. The first thing you will do is to check the client chart and to verify the doctor's order and to ensure that you are administered the procedure to the right client. Perform hand hygiene. It can prevent spreading of microorganisms. Explain the procedure and screen client to allay client fears and anxiety and also to provide a privacy. Good morning, ma'am. I am Isa, your nurse for today. May I know your name? Can I check your wristband? Okay, Mrs. Terry. Mrs. Terry, your doctor has ordered to give you a perineal care in order to your urinary catheterization letter and to prevent any infection. This procedure will help clean any discharges and that might cause any infection. After that, assemble all the equipment. This is a pitcher with a sterile water. So I just assume this is a forceps or a working forceps, and this is a sterile gloves. This is a cotton ball, and this is a sterile pad, and also this is a waterproof pad and a bed pad, and also we have a waste receptacle. Place the client in dorsal recumbent, the client lying on her back with legs separated and knee flexed, for the client to have a comfortable position and also for the nurse to have accessibility to the procedure. The first thing to do is to apply an additional blanket to provide the privacy and warmth. I'll move the sheet back to expose only the lower part of the body. Mrs. Sir, can you flex your knees and with separated legs? And I'll take the waterproof to place under your hip. Alright? Thank you, Miss Terry. And can you lift your hips for me? And I slide the pad. Gloves protect against exposure to blood and body fluid. So I assume that the patient is in the recumbent position. Then I'm gonna separate the labia and pour the sterile water and get a cotton ball with a soft side solution, and I'm gonna wipe the labia downward the side, and then discard and get a new cotton ball. I'm gonna do the same stroke with the rule of 7 motion from the clitoris to the downward. Then discard, get a new cotton ball. After that, wipe the labia majora with the same figure or 7 motion and then downward. Then throw away the used cotton ball and get a new one. Then the inner part downward, then discard and get a new one. The middle part, wipe the middle one solution. Whenever retrace stroke, it has something to do with the control of spreading of microorganisms. After cleaning the sterile water, we are now going to dry it. So I'm gonna get the dry cotton ball and spread the labia. And wipe downward with the same stroke and discard. I get another one, discard and spread the inner part, manora, and down to the anus, spread. Clitoris to the inner part, then spread, discard, and then in the middle of the, then discard. Now I'm going to apply the sterile pad to the patient, and I'm going to wear her underwear, and after placing the client underwear, I'm now covering down her blanket and make the her does not wet, and the buttock and back should be kept dry because it can irritate the skin of the client. We remove the blanket and make sure that the patient is not wet because it can irritate her skin. Wash hand after the procedure to maintain the cleanliness and to prevent the spreading of microorganisms. Check back the client to evaluate if the good pericare was properly rendered. And the last one is to document the following procedure. First is date and time started and finished. Second is the response of the client during the procedure. And third is any unusual findings such as redness, skin breakdown, discharges or any drainage, and any localized area of tenderness.